Okay, this segment of the presentation talks about continuous quality improvement programs. The program requirement is, the goal is to detect, document, assess, and prevent quality-related events, or QREs. And individual responsible for program compliance, identifying and documenting QREs, minimizing the impact of QREs on patients, analyzing data to assess causes and contributing factors, and formulating responses. So the whole goal of QREs is to establish workflow and processes and training to prevent future quality-related events. With regards to notification and documentation, all employees shall be trained to inform the pharmacist of a quality-related event. The pharmacist must notify the patient or caregiver and other members of the healthcare team. The pharmacist also needs to provide direction for correcting the error. Additionally, the pharmacist should provide instructions for minimizing negative outcomes on the patient. With regards to documentation, it should be done on the same day that the pharmacist was notified, and the documentation shall include a description of the event, the date the event was discovered and the date notified, the name and titles or person recording the QREs, description of the QRE reviewed, and documentation of contact to the patient as well as other members of the healthcare team. The records of CQIs should be maintained at the premise, and it should be readily available to all pharmacy personnel. QREs shall be maintained for at least 2 years, and they should be filed by date. When a QRE results in a serious injury or harm to the patient, such improper dispensations shall be reported to the board within 15 days. So what is the goal of monitoring quality-related events? Is it A, to formulate responses to prevent future QREs? B, to identify individuals responsible for medication errors? C, to deliver punitive measures against pharmacists making dispensing errors? Or D, all of the above? And medication errors, it is a system problem. It is not specific to a particular individual or pharmacist or technicians unless there was some negligence or malice intended. The goal of preventing medication errors is to analyze the workflow, the processes, and to prevent such errors from happening again. Medication errors is not a punitive, should not be punitive. Again, unless it was negligent or intentional. So answer C is out. To identify individuals responsible for medication errors. Again, medication errors is a system problem. And so the goal is to learn and how can we improve the system. Perhaps add some safety cautions or alerts to alert the users. So B, it's not the individual, it's more of the system. So the correct answer here is A, to formulate responses to prevent future QREs. How long do QREs records need to be maintained? Is it A, 6 months, B, 1 year, C, 18 months, or D, 2 years? And the correct answer here is D. QREs need to be maintained for 2 years, and they shall be filed by date.